So I'm going to give you an overview of the project and what we plan to do, which is very exciting. I would also like to acknowledge country and just acknowledge that this week is NAIDOC week and to celebrate Aboriginal and Torres Strait Islander culture across the country. I'm joining from Wurundjeri country and also Bunurong country, and I'd like to pay my respects to the elders past and present who have cared for this land so well for millennia. So the project team is a really big team. Some of you on the Zoom are on that team. And it also, you know, the work, but prior to this project team has also been, has also involved several of you, and you may recall that I did my PhD supported by the CRE in cerebral palsy, which was related to bike skills training. Started that in 2015, so almost 10 years ago. So it's been a big journey. So thank you to everyone who's supported us along the way. And this is the project team of chief investigators, associate investigators, and 11 partners who have supported the project through in-kind and cash funding. So as John has so clearly articulated, cycling is a popular activity for young people with disability, and the benefits of therapist-led skills-based programs have been demonstrated with some signals that it improves participation, but the longer term ongoing participation in the community is an area that has been lacking. And to our knowledge, there's no community-based cycling initiatives that are inclusive of young people with disability that exist in Australia. So in response to this need, we co-designed the principles of the CycLink program. And as part of this grant, we will be implementing and evaluating the program across 2 metropolitan and 2 Victorian regional locations. So the overall research aim is to determine whether participation of children and young people with disability in their local communities improves by implementing and evaluating this co-design cycling program across these locations. On my slides. So John mentioned that we used an experience-based co-design approach to undertake the co-design study, and we will be using this as a meta framework for the remainder of the project. So in the previous 2 years, we completed the first 3 steps of setting the program up for success through the engagement of our co-researchers, gathering the experiences through those photo elicitation interviews, and then understanding these experiences through the co-design workshops and development of the principles. We'll now be improving that experience through further co-design workshops, which I'll talk to in a moment, and then monitoring and maintaining these experiences of cycling through an implementation effectiveness trial, which I'll also talk to in just a moment. So based on the work that we did through the co-design study and the principles, we put forward some prototypes to our co-design workshops, but also then further refined with our partners and with the co-design steering group, and decided that there were these 3 key elements of the cycling programs that needed to be part of it in order to achieve the goals of the program. So the first one is a cross-sector delivered cycling group program. The second was these opportunities to trial assistive cycling technologies. And then the third was an online cycling resource for families. And what that then looks like in the program design, and drawing in previous work that I did in my PhD with a therapist-led cycling program and our partnership with Oz Cycling and their Ozbike program, is that for the group-based program, it would involve a 6-hour holiday-based skills intensive program and onboarding with a therapist that then transitions into a 6 to 8 week group program, which is part of the Oz Cycling Ozbike program, which we're going to be doing some further co-design work to refine, which is led by a coach, a cycling coach from a local club. The second element is the adapted cycle trials, and this is regular therapist-led opportunities to explore assistive cycling technology alongside the group-based program. And finally, the online cycling program or resource, which is available to families throughout the intervention or the program period. So as part of phase one, which is the first year of it's a 5-year project. So the first year of the project, we will be further refining those key elements of the cycling program through further co-design cycles. And in particular, the first co-design cycle will focus on the coach-led Ausbike component of the group program, so that community-based component. The Ausbike program is currently being launched across Australia, but it does not have a focus on including children with disability nor adapted bikes. So we're working with AusCycling and our other partners to co-design a revised version of this, which will be for all abilities. The second co-design cycle will focus on the development of an online cycling resource for families. And you may recall some of the work that John and myself and others did earlier on, just in the COVID period and just after, through the CHAIN program, which was an online training program for providers. So we're going to be looking at how we can adapt much of the materials from that program for families and have it on an online web-based format and platform. Phase 2 is a hybrid effectiveness implementation trial with a mixed methods evaluation. And we'll be doing this through a randomized control trial with 104 children and using RE-AIM as a framework. And some of you may be familiar with the RE-AIM framework, but the key constructs that it looks at to evaluate implementation of a program are reach, effectiveness, adoption, implementation, and maintenance. And I'll talk through just at a high level how we're going to do this for each of those constructs. So to determine the extent to which CycLink reaches children who reflect the profiles of children and young people with disability, we'll be looking at data across census data and our participant characteristics data, as well as undertaking qualitative interviews. To look at effectiveness of the program and improving participation as our primary outcome, as well as physical activity, social connection, and well-being. We'll be doing a randomized control trial. To determine the extent to which cycling is adopted by providers, we'll be undertaking a survey of provider characteristics, as well as the organisational readiness for implementing change questionnaire and qualitative interviews. To look at implementation, including those constructs of acceptability, feasibility, which will include an economic evaluation as well as fidelity. We'll be looking at provider training records. We'll be undertaking the acceptability and feasibility of intervention measures, undertaking an economic evaluation and doing qualitative interviews. And if shown to be effective, we'll look at the extent to which cycling is maintained by providers and continued to demonstrate effectiveness by looking at a survey, as well as document analysis and qualitative interviews. So just to focus on the effectiveness outcomes, this is just the trial design where the child is recruited to one of 4 sites. So we've identified our sites as inner southeast metropolitan Melbourne and outer southeast metropolitan Melbourne, Ballarat and Geelong, and that's based on our partners. The children will so we'll have 104 children in total, and they'll either be allocated to the CycLink program or to the comparison, which is access to the online cycling resource only. However, after 6 months, those children will be able to be eligible for the CycLink program. So it's a waitlist design. As I mentioned earlier, the outcomes we're looking at is cycling goal attainment and participation, physical activity, social connectedness, and well-being. So some of the anticipated outputs include the involvement of our participants. So these are the people involved, including the young people with disability who access the program, their family members, practitioners, therapists, local government, and managers and leaders across those sectors. We'll have the group program will produce a program manual and training for coaches and therapists. And we will also deliver the program to 104 participants. The adapted bike hub component will provide opportunities for trialling adapted bikes and create connections between suppliers and families and practitioners involved in the trial, and potentially looking at with the online cycling resource how we can adapt chain for families and create more education and knowledge and that informational pathway that John was talking about. And overall, as a whole of project, we anticipate that we will continue to form partnerships that we've already formed through the development of this grant, community networks in each of the sites, as well as publications and presentations, and a sustainable model for ongoing delivery, which we hope to scale nationwide following the implementation of this grant. So some of those other sort of anticipated outcomes, we're hoping really to address some of the barriers to participation in this cycling context through a first of its kind partnership across the sectors of health, disability, sport, education, government, and people with lived experience of disability. So as John mentioned, one of our participants said we've got to get out of the silos, and we're really trying to do that through this grant. We're trying to create practice change, look at implementation strategies, and create evidence to inform policy and funding decisions by trialling this novel approach where it's co-sector delivered, and that we hope that we can serve as an exemplar of services and providers working together across sectors to improve participation. And as I mentioned, we're aiming to refine as we go along, scale and sustain nationally beyond the project timeline, so beyond 2029. This is just a bit of a complex timeline, but as I mentioned, this first phase of the program, the further co-design, will happen in the next year, with 2025 to 2029 really focused on the implementation of the trial and evaluation of the implementation and effectiveness outcomes. So thank you so much for listening.